Hi, my name's Angel Perez. I'm going to be talking about otis externa, also known as swimmer's ear. It's an infection with inflammation of the lining of the external ear canal caused by bacterial or fungal pathogens. Most often caused by exposure to moisture left in the ear, can also be due to contamination or local trauma. Some common signs and symptoms for otis externa is going to be pain, itching is an early sign, redness, drainage, lacerations, blistering or abrasions of the ear canal. Also, hearing loss. Some diagnostics tests that are going to be performed with otis externa are going to be a CBC, which will show a elevated white blood count, as well as a ear drainage culture and sensitivity test, an odometric and whisper tests that can indicate hearing impairment. Therapeutic measures done for otis externa are going to be pain management, debridement, and surgical repair. Common medications for otis externa are going to be pain meds, topical antiseptics, topical antibiotics, systemic antibiotics for severe infections, and topical steroids.
Hi, this is Tammy Weber, and I'll be talking about otitis media. Otitis media is an inflammation of the middle ear, mastoid, and eustachian tube. It's most common disease of the middle ear and is often caused by fluid, pus, and/or air building up, caused by an inflammation of the nasopharynx, which blocks and impairs the middle ear ventilation. There's three main types of otitis media. First is otitis media without effusion. This is a mucosa inflammation without any drainage. Then the second type is acute or suppurative or purulent otitis. This is caused by a bacterial infection of the mucosa, which can become chronic if lasting more than 3 months. Then the third one is otitis media with effusion, or serous or non-suppurative otitis media, or also called glue ear. This is non-infective fluid which accumulates in the middle ear. Signs and symptoms of otitis media are fever, earache, also feeling a fullness in the affected ear. There's pain and could be conductive hearing loss from the purulent drainage. Also, nausea and vomiting may be present. There may be a reddened, bulging tympanic membrane. And drainage out into the external ear canal will happen if rupture of that tympanic membrane occurs. Also, there could be mastoid tenderness. This indicates that the infection may have spread to the mastoid area. Here we have more signs and symptoms of otitis media. These are ones that are going to show more in children who are the ones who most commonly have otitis media. You will see them pulling at their ears. They're going to have a loss of appetite. This commonly occurs because any kind of sucking or movement of the jaw is going to cause pain or aggravate pain. There is also commonly seen a fever of up to 104 degrees. There's post-auricular, excuse me on that, and cervical lymph node enlargement. You will see a decrease in the pain after the tympanic membrane ruptures. Some things that they are given is antibiotics orally. You also have ear drops, antipyretics for your fever, and a lot of times children have to have tubes put in to prevent the common occurrence of otitis media. For diagnostics, You will see a CBC possibly done to check for elevated white blood cell counts indicating the infection. You will also have ear drainage, culture, and sensitivity tests. This is done to isolate specific infective organisms. Then you have the Reina and Weber audiometric and whisper tests that are done to indicate any possible conductive hearing impairment. And then there's imaging study that can be done to indicate or diagnose the infection. Therapeutic measures are the Pulitzer ear device, which is also called the ear popper, to help equalize pressure and aid in the drainage of the fluid. What happens is a stream of air is emitted into the nasal cavity to gently open the eustachian tubes, which relieves your negative pressure, allows pressure to equalize and fluid to drain. Then you also have surgical interventions. First, you can do a paracentesis through the tympanic membrane to drain the fluid. Then you have a myringotomy. This is an incision that is surgically made into the tympanic membrane to drain the and suction fluid, and then a transtympanic tube is inserted through the incision to keep it open, which also helps to equalize the pressure and to prevent further fluid buildup. This is also done using laser-assisted measures, and that actually vaporizes the tympanic membrane. And again, your tubes are inserted in that incision made to keep it open to help drain and equalize pressure. Then you have a myringoplasty, I hope. This is reconstructive repair of the perforated tympanic membrane. Sometimes I do believe they use a gel foam over the perforation to aid in the healing. And last, if the infection has spread to the mastoid area, they'll do a mastoidectomy. Then you have an incision, they do drainage, and then they do a surgical removal of the mastoid process. Complications of otitis media: when tympanic membrane ruptures, while initially causing relief in the pain, it can cause hearing loss, which can also lead to permanent hearing loss. You also have a cholesteatoma, I hope. This is a cyst-like sac that forms. It's filled with the debris from repeated infections. It starts in the external canal and it spreads to the middle ear. Damage then occurs from necrosis from the pressure on tissues, and conductive hearing loss results. Also, as it progresses, facial paralysis and vertigo can also occur with that. There is tympanosclerosis, which again, repeated infections will cause deposits of collagen and calcium on tympanic membrane and the middle ear. This leads to conductive hearing loss. Then you can also have mastoiditis. This occurs if the acute otitis media is left untreated. The infection can spread to the mastoid area. This has become uncommon due to the use of antibiotics.
Hi guys, my name is Reina Balboa and I'll be talking about your otitis media and their common medications. The first one they will have is their topical antibiotics, which is their Cipro HC Octic, which has ciprofloxacin and hydrocortisone in it. The second one is the cortisporin Octic, which has hydrocortisone, neomycin, and polymycin B in it. The second one of the antibiotics is systemic. Those consist of the amoxicillin, erythromycin, which is known as Zithromax, and their oral analgesics. Now on to in-class questions that we prepared for y'all, so hope you're ready. So guys, the first question is, a patient comes to the health clinic for suspected ear infection. Which of these data collection findings does the nurse expect with external ear infection? So which of these? Dizziness, fullness in ears, redness, pain, pruritus, and swelling. I'll give y'all a minute. So the answer to these questions is 3, redness, 4, pain, 5, purpuritis, and 6, swelling. Question number 2, what is the nickname for otitis externa? What is the nickname that they give them? The answer is 2, swimmer's ear. Question number 2, what is the nickname? Okay guys, question number 3 reads, in a patient with otitis media, does the patient have or develop the signs and symptoms of a fever? True or false? The answer is true. Question number 4, which section of the ear does the inflammation occur in otitis media? Is it 1, middle of the ear, 2, external ear, 3, ear canal, or 4, the tympanic membrane? Give you a minute to answer. The answer is 1, the middle of the ear. Okay guys, final question. What signs would a patient present with otitis media? Select all that apply. We have answer choices: fever, earache, fullness in the affected ear, or headache. And it's a select all that apply. So the answer is they're going to have a fever, earache, and feeling of fullness in the affected ear.